Hi everyone, we're Group 7 and we're here to present to you Real-Time Locating System, RTLS, and this is to help transform acute and hospital-based care. So to present to you our team here today, my name is Helen, we have Chrisleen, Jordan, Enzi, and we're all fourth-year Health and Information Science students. So with RTLS, it was found that when implemented, the average length of stay was able to decrease by 10.6%, and that's evidently shown in Providence Holy Cross in California. And this resulted in a $543,000 cost savings.
Our team will discuss our RTLS proposal in 4 sections. First, we'll give a background on Pillar 3. Second, present our RTLS recommendation. Third, lay out our implementation plan. And lastly, discuss the facilitators and potential barriers to implementation. The BC Ministry of Health envisioned optimal health and wellness for every British Columbian and committed itself to digitally transforming our health system. Pillar 3 is one of the 5 strategic pillars of the ministry's digital transformation strategies. It is focused on the transformation of acute and hospital-based care, which aims to accomplish the following: maximizing health system benefits, achieving cost effectiveness, leveraging strategic collaborations, and utilizing standards to align new systems with the workflows and processes. Why should the ministry prioritize the transformation of acute and hospital-based care? It is known that hospitals account for the largest health spending in Canada, 60% in 2018 nationwide, and 58% of the total acute care budget of BC in 2015 and 16 calendar. Additionally, health services continues to become increasingly complex. At the same time, digital technologies are maturing and expanding exponentially. And lastly, prioritizing EHR will help mitigate the risk related to the fragmented care and enable improvements in quality and safety, outcomes and experience, and population health and system sustainability.
And therefore, to strengthen the transformation of acute and hospital-based care, our final recommendation is the real-time locating system. RTLS uses radio frequency identification tags and network sensors and transceivers installed throughout the hospital to track patients, staff, and assets. The location of the tags is usually displayed near the nurse's station, and healthcare workers can access from the workstation through the reader. And the reader of the system provides a quick dashboard-like snapshot showing real-time updates on patient information at any time, including patient location, lab results, and medication. RTLS can bring many potential benefits to hospitals. It contributes to overall cost reduction by improving operational efficiency and increased resource utilization. Also, it helps to decrease patients' average length of stay by improving bed turnover times. It can save time for providers to look up information and pieces of equipment. It can save time for registration personnel as well. RTLS can facilitate better record keeping, thereby improving understanding of process at the facility and accountability of staff. Overall, the system can improve the accuracy, reliability, speed, and safety of the care provided, resulting in increased patient satisfaction levels. And for the adoption to current initiatives, currently, the major projects that are conducive to hospital care include 3 projects: clinical system transformation, iHealth, and Care Connect. The implementation of RTLS is beneficial for these projects to better implement their corresponding plans. According to the CST project, physicians can check a patient's updated chart while the patient is still in the ED, and RTLS that can utilize wireless chips or tags to track patients' real-time locations help to provide physicians with more accurate patient information. Also, the panic button component of RTLS enables healthcare workers to immediately alert others to location-specific emergencies in the ED or other places. As for iHealth, the implementation of RTLS can also help to solve some of the CPU usability issues that iHealth is facing, including disappearing orders or untimely or irrelevant notifications. Real-time tracking, recording, and storage of orders can update ordering information in time, which will lower the rate of ordering disappearance and improve the accuracy of notifications. Thus, while patients are being transferred from one department to another with one hospital, their transfer records collected by RTLS can be uploaded to CareConnect system immediately so that CareConnect can update real-time patient information. In addition, the use of RTLS can help to enhance the clinical information sharing, thereby enhancing the accuracy of shared decision-making. Let Christine and Helen talk about our implementation plan.
To successfully implement the RTLS in BC, it is important to consider two things. One is the principles of digital health transformation that are specific to the MOH, and two, apply best practices of system implementation. The MOH principles to consider throughout the implementation process are patient and provider experience, learning and insight, accessibility and appropriateness, cost efficiency and sustainability, population health outcomes, privacy, and security. The steps to a successful implementation includes recognizing the need for implementation, reviewing the current system workflows and processes, select a system based on needs, set objectives and goals, and lastly, analyze performance.
So the predicted timeline for our initiative is 22 years. So in the first year, after Ministry of Health decided to implement RTLS, then it'll conduct project planning and also procurement for the software and also hardware. And the second year, after the team is established, system integration will be conducted. So to make sure that the system will integrate with the current system used in the hospitals. And also initial pilot study will be conducted at one of the sites to make sure that it's working before implementing across 161 hospitals in BC. As for the scope of the project, it's planned to tag 4 different categories. So first will be the asset. So these are the items that are more than $100. They're fast consumer items and they have a short lifetime. As for people, we're planning to track patients and staff. So patients that are prioritized to be tracked will be the ones that have high risk. And staff that are prioritized to be tracked will be the ones that are moving frequently between different facilities and are highly sought after to provide medical care for patients. And as for the workflows, the time-sensitive and location-sensitive workflows are focused and also the ones that have the highest return on investment. Lastly, for tracking supply flow, we're focusing on tracking personal protective equipment, also medical supply and other medical equipment to make sure that they're not going missing and to maximize utilizing those equipment. So to calculate the budget and cost, we made some assumptions that are not all listed here. To learn more about it, refer to our report. So here for the assumption, we assume that there are 161 hospitals across BC and only 3 hardware costs listed on the table on the left here that we assume is not already owned by the facilities. And also only the equipment and patients will be tagged for the sake of the calculation. So the main hardware cost is estimated to cost total of $12 million, and then the software costs will cost $500,000. As for the labor costs, it's estimated to cost $16 million. So this comes to a cost saving of $599,000, and the cost of investment will cost about $29 million. This comes to an ROI of negative 98%, even though this is not a very promising ROI with different changes in the project scope and timeline, and also the type of hardware and software that's purchased, it could be changed. And also the patient outcome benefits could potentially overcome the cost. And next, quality measurement plan is developed to guide the project team and also project manager to execute various quality management and assurance activities. Also, this helps to develop quality policies and procedures, to develop the deliverables and also document different members' responsibilities in the project. And this also helps set quality standards. So this can help with the deliverables and also stakeholder expectations, quality control and assurance activities, and also process quality standards. Lastly, to measure the different qualities, different quality planning tools can be used, such as cost-benefit analysis, benchmarking, control charts, and also Pareto charts. And next, NZ will talk about the facilitators and barriers.
Thanks, Helen. So according to our strategy of transforming acute and hospital-based care, the three main factors to facilitate RTLS implementation are clinical workflow improvement, expenses reduction in a long run, and 5G positioning integration. By working closely with the RTLS, it can automate the workflows of hospital staff. For example, it saves time for them to find patients if they are away from their hospital beds. It also alerts the service department for cleaning the inpatient room if patient is being discharged. A study already proved that RTLS is increasing hospital bed capability from 5 to 20%. So we can see that it helps the hospital adapting more patients and also decrease the surgical wait time. From the financial point of view, implementing RTLS helps the hospital to save time. Implementing RTLS helps the hospital to save money in a long term. It prevents equipment loss or misplacement by tracking them in real time. It also helps hospital staff to make accurate order decisions. More than that, it supports hospital to against the potential lawsuit. If unexpected incidents happen with patients, their family member gonna sue the hospital for missing cares. RTLS can generate visit report to show whether the physicians or nurses did in fact visit the patient as promised. Lastly, 5G positioning can be integrated to RTLS to have more accurate tracking feature. It can be beneficial for infection control in the hospital and patients and equipment tracking. Even though there are many benefits with RTLC implementation, challenges still appear. The first challenge is the ethical concern. Because the system is used to track both patient and hospital staff with informed consent, then it against the right for patient autonomy. Also, information privacy and data security with RTLS are being questioned in the public. So to mitigate this challenge, we can use an ethical assessment tool to test the system. Also, beta testing is also important to uncover usability issues and bugs of the system before it releases. So after all that, I believe not only ethical issues, usability issues can also be solved. The second challenge I'm going to talk about is the expenses of implementation an appropriate system. Selecting an appropriate system would waste money and cause the project to pause and over delayed. To mitigate this situation, project preparation is needed. By dealing with many different vendors, asking references from existing customers of previous work is important. Also, a qualified procurement team is needed as well for cost estimation. Overall, having comprehensive preparation is important to select the most appropriate system. There are some risks associated with not pursuing RTLS. Without this tracking system, there would be extra cost for loose or misplaced equipment. Also, missing track of patients have risk of infection spreading, which miss the opportunity to deliver the real-time care to patients. Moreover, it will lead to efficient use of hospital facilities and access. Then the hospital would have less chance to reduce their hospitalization and surgical wait times. Overall, the Ministry of Health could not achieve the goal aligned with their digital strategy of transforming acute and hospital-based care to minimize cost in the long term, improving patient experience and care quality, and achieving clinical work term efficiency. That's all for our presentation. Thanks for listening. If you have any questions, please reach out to our professor to contact our group. Thanks.